It can also cause heat-related illnesses that we need to take very seriously. There are things you can do to avoid those illnesses, though. Joining us from our newsroom, Dr. John Shufeldt, the medical director from Native American. Good to have you, doctor. How are you doing today?
Thanks, Jonathan. Doing great.
You know, some people think that the sun is all good and there can be no possible bad effects of being in it. That's not necessarily true, is it?
Absolutely not. There's actually quite a few of the bad effects that the sun has. You know, one of the long-term effects that we talk about is just sun-related damage to your skin, but also cancer that long-term sun exposure can cause. And you know, one of the things we tell people is using different kind of sunblocks. This one I found has an SPF factor of 70, which is actually the highest one I've seen out there right now.
I hear you. Now, this SPF 70 is significantly different than an SPF 5, 6, 7?
Yeah, absolutely. It's, you know, it basically rates what kind of block it has against the sun towards your body, and what it blocks actually is the UV radiation and different things that can cause chemical damage and structural damage to your skin.
There are some people who are going to think that this 70 SPF is going to not allow them to get any sun, any colorization in their skin when they sit out. Is that true? And if so, how far down do they have to go before they can be protected and get a tan?
That's a great question. I think SPF 70 is the highest one I've seen out right now. If you put it on, will you still get some sun exposure? You know, absolutely. It depends how long you stay out and how often you reapply it.
Okay. Now, from long-term effects to short-term effects, let's talk about heat stroke. What are some of the things that people need to do to avoid heat stroke out there?
And that's actually one we see quite a bit in the summer, especially with roofers, for example. People who are in the sun or in a hot environment for a long time and don't have adequate hydration. Jonathan, all heat stroke really means is that your body's temperature exceeds its ability for evaporative cooling or sweating. And once that happens, your core body temperature goes up to 107, 108, and we see every year quite a few deaths just related to that heat. So what can people do? One, obviously, the answer is stay out of the hot sun, stay out of the hot environment. But while they're in the sun, actually keep themselves well hydrated. And the thing most people use is just plain old water. It works absolutely great. However, if you're in the sun for a prolonged period of time and drinking a lot of water, one of the things your body does is it sweats out sodium or salt. And if you're just drinking water after water after water, that sodium constantly gets lower and lower and lower. So you look at some things that can replace the sodium, and one of them that we all have had before is the Gatorade. Gatorade has the most sodium, the highest sodium concentration for most of the electrolyte replacement drinks.
Sounds to me like a good plan of action would be to hydrate yourself with water, but once you're out in the sun for a while, think about the sports drink that has sodium to replenish those things.
Exactly, sodium and potassium. It's sodium primarily.
All right. Thanks so much for being with us today, Doc.
Easier. Joining us this afternoon is Dr. John Shufeldt with Native Air Ambulance. Welcome, doctor. Thanks so much for being with us.
Thanks for having me, Carrie.
You have some really good information to help in an emergency situation. First off, let's talk about 911. What kind of information should people have handy when they make that call?
Well, a lot of times when people call 911, obviously they're upset, which is the reason they're calling 911. However, if you're able to slowly give the problem at hand, why you're calling them and where the person's located, that alone will make the job of the rescue workers that much easier, because it's that much easier than to come and aid them, the person who's having problems.
So is it good to know maybe the address offhand, the phone number, where you are? Do you need to have your insurance card or something like that to kind of hurry along the process?
No, absolutely not. I mean, anybody in emergency medicine basically practices it because they love doing that kind of medicine, and real, you know, insurance and payment issues are the last thing people worry about. If you just say, here's what's wrong, here's where we're located, you know, please hurry, they'll get theirs absolutely as quick as they can.
When is it time to make that 911 call? When should you take it out of your hands and call emergency crews?
Well, there's kind of a problem right now in emergency medicine, and what happens is people use a 911 system, and they always show up, but they use a 911 system when it's not a true emergency, so it is hard for people to figure out when to call them and when not to call them. If there's a life-threatening problem, and by life-threatening I mean crushing chest pain, severe headache that's new or unremitting, some sort of major trauma, or anything that causes the person to have an alteration in their mental status, that's the time to call them. The problem is when people call them and they don't have those serious conditions, they take that crew out of service for somebody who may have that serious condition and actually can affect the course or life of someone else.
Good point. What about hospital visits? How can we make those go more smoothly?
I think with a hospital visit, particularly the emergency department, there's probably no way to make it an easy or smooth experience. However, if you walk in there with the patient's name, date of birth, and sort of demographic data, their insurance plan and all the rest, it makes it a little smoother. We still see them regardless. In fact, they get seen before we ask them anything short of their name and why they're there.
I understand you have a special form that's good for people to fill out. It has all the necessary information that doctors might need. Is that true?
Exactly. If they go to www.nextcare.com, they can download it right from our site. It's a PDF file, and fill it out, and it asks for your past medical history, which is very helpful to carry, and then also the demographic data, who your physician is, who to contact if there is an emergency. Having that when you walk in is very helpful. I can't tell you how many times people have come to see me and they have their whole medical history written out, and they have all their medications written out, and it's an absolute huge and potentially life-saving thing that they do.
Is there anything final that you'd like to say to encourage people to help out emergency workers, make their job a little bit easier?
Well, you know, you pointed out that it is National Emergency Services Week, and it is just the job that these men and women do on the scene and in the air. I can't tell you, I can't say enough positive about, because they truly risk their lives on a daily basis to help save and rescue other people. So for them, I can just say thanks and my heartfelt gratitude.
All right, thank you so much. We do want to mention the nextcare.com website that Dr. Shufeldt just mentioned a moment ago, where you can get that special form to fill out all the information and give to your doctor. We have created a link from our website. Just go to Phoenix.